Have you ever wished for a cure for the effects of aging on your heart and other organs? Well, the wait might be over. A groundbreaking study led by scientists at the University of Bristol and the Multimedica group in Italy has uncovered an anti-aging gene that can potentially rewind the heart's biological age by close to 20 years, with similar effects on other organs. This exciting discovery could change the future of heart health and offer a target for patients with heart failure. This new study showcases the exceptional benefits of healthy mutant genes, which are often found in individuals who live to be 100 years or more and remain in good health. The gene has been found to halt the decay of heart function and even reverse the heart's biological clock. This new wave of treatments, inspired by the genetics of centenarians, may lead to a safer and more viable alternative to gene therapy. So fasten your seatbelts and get ready for a journey into the future of heart health as we explore the exciting implications of this breakthrough discovery. A major breakthrough in the fight against heart disease has been discovered, and it could change the way we approach aging and longevity. Scientists at the University of Bristol and the Multimedica group in Italy have found that a gene commonly found in centenarians can reverse the heart's biological age by up to 10 years. Centenarians are individuals who have lived to 100 years or more and remain in good health. They are often associated with exceptional longevity and are less prone to cardiovascular complications. This new study has found that one of the healthy mutant genes that these individuals carry has the potential to protect against heart disease and heart failure. The study showed that a single administration of the mutant anti-aging gene halted the decline of heart function in middle-aged mice and even rewound the heart's biological clock age by the human equivalent of over 10 years in elderly mice. The team of scientists believes that this gene could be the key to keeping hearts young and healthy, protecting against diseases associated with aging. The heart and blood vessels are put at risk as we age, and the rate at which these harmful changes occur can vary from person to person. Lifestyle factors such as smoking, alcohol consumption, and a sedentary lifestyle can accelerate the aging clock, while a healthy diet and exercise can slow it down. In addition, having good genes inherited from parents can help us stay young and healthy. This new study shows that a healthy gene found in centenarians could be transferred to other individuals to protect their hearts, and there may be other mutations discovered in the future with even greater curative potential. The study has been funded by the British Heart Foundation and the Italian Ministry of Health and has already received additional funding from the Medical Research Council, Diabetes UK, and the British Heart Foundation. The researchers hope to test the effectiveness of the protein in clinical trials on patients with heart failure in the near future. Professor Paolo Madedu, one of the study's authors, believes that this discovery could fuel a new wave of treatments inspired by the genetics of centenarians. The team is also investigating whether giving the protein instead of the gene could work, as a treatment based on a protein is considered to be safer and more viable than gene therapy. The future of heart health is looking brighter, and this discovery could mean a new era of treatments and therapies aimed at reversing the aging process and protecting against heart disease. With funding from several organizations and further research planned, this is an exciting time in the fight against aging. David Sinclair, a renowned researcher and geneticist, has been making waves in the field of anti-aging with his work on the Yamanaka factors. Sinclair and his team at Harvard Medical School have been exploring the role of these 4 genes in reversing the aging process in cells and organisms. The Yamanaka factors are a set of genes that can turn back the clock on cells, transforming them from a specialized state into a more primitive stem cell-like state. This process, known as cellular reprogramming, has the potential to rejuvenate cells and organs and reverse the effects of aging. Sinclair's research has shown that by introducing the Yamanaka factors into cells, it is possible to reset the biological age of cells and reverse the signs of aging. In a breakthrough study, Sinclair's team used the Yamanaka factors to reverse the aging of mice, resulting in improved heart and liver function, enhanced physical performance, and a longer lifespan. This groundbreaking research has the potential to lead to the development of therapies that could help people live longer, healthier lives. By reversing the effects of aging, we could potentially prevent or cure age-related diseases such as heart failure, Alzheimer's, and diabetes. The potential applications of Sinclair's work extend far beyond just anti-aging. By resetting the biological age of cells, it may be possible to regenerate damaged tissues and organs, offering hope to patients suffering from a range of debilitating diseases. Sinclair and his team are now working to develop a safe and effective way to deliver the Yamanaka factors into the human body. While still in the early stages, the prospect of a treatment based on Yamanaka factors is incredibly exciting and could represent a major milestone in the fight against aging. Sinclair's work is not without its critics, however. Some have raised concerns about the safety of manipulating the aging process and the potential long-term effects on human health. Nevertheless, Sinclair remains optimistic and is committed to continuing his research in this field. The discovery of the Yamanaka factors and their potential to reverse the effects of aging represents a major turning point in our understanding of the aging process and could have far-reaching implications for the future of medicine and human health. By continuing to explore the potential of these genes, Sinclair and his team are paving the way for a new era of anti-aging treatments and therapies. David Sinclair's work on the Yamanaka factors has the potential to revolutionize the field of anti-aging and offer hope to people everywhere. The implications of this research are vast, and its potential impact on the future of humanity is impossible to overstate. We look forward to watching as Sinclair's work continues to evolve and bring us one step closer to a world where aging is no longer a threat to our health and well-being. The potential benefits of longevity research and reversing the aging process are numerous and could greatly impact humanity. If we are able to slow down or reverse the aging process, people could potentially live longer and healthier lives, which would reduce the burden on healthcare systems and result in a happier and more productive society. This could also lead to a decrease in age-related diseases such as heart disease, stroke, and dementia, which are among the leading causes of death in the world. In addition to the health benefits, longer and healthier lives could also have a profound impact on the global economy. With an older and healthier population, people could continue to work and contribute to society for longer, which would increase productivity and drive economic growth. This could also result in a decrease in the number of elderly people who are dependent on government support and reduce the burden on pension systems. However, there are also potential downsides to longevity research and reversing the aging process. One concern is the ethical implications of extending human life. For example, if we are able to extend life significantly, there may be a decreased sense of urgency to solve problems such as climate change, as people may feel they have more time to address these issues. Additionally, there could be unintended consequences, such as an overburdened healthcare system or increased economic inequality, as those who can afford these treatments will have access to longer and healthier lives. Another concern is the impact of longer lifespans on the environment. An increase in human life expectancy could lead to an increase in resource consumption and waste, which could have a negative impact on the environment. In order to mitigate this, we need to ensure that the research into longevity is done in a responsible and sustainable manner. The psychological implications of reversing the aging process are also worth considering. If people are able to live significantly longer and healthier lives, there may be a shift in societal attitudes towards aging and death. This could have a profound impact on how people view the latter stages of life and could lead to new social, cultural, and psychological challenges. Furthermore, there are also concerns about the cost of reversing the aging process. Gene therapy and other treatments to slow down or reverse the aging process are likely to be expensive, and there is a risk that only the wealthiest individuals will have access to these treatments, leading to further economic inequality. The potential for genetic discrimination is another concern. If employers, insurance companies, or other organizations have access to information about a person's genetic profile, they may discriminate against individuals based on their perceived health status, which could lead to further social and economic disadvantage. In conclusion, The potential benefits of longevity research and reversing the aging process are significant, but we need to consider the potential downsides and ensure that this research is conducted in an ethical and responsible manner. This requires a collaborative and interdisciplinary approach involving experts from fields such as medicine, biology, psychology, sociology, and ethics. As we continue to explore the possibilities of gene therapy and other treatments for reversing the aging process, it's important to consider the potential impacts on humanity and ensure that we are able to realize the benefits while avoiding the downsides. Only by approaching this research with caution and collaboration will we be able to unlock the full potential of longevity research and have a positive impact on humanity. While anti-aging gene therapy is still in its infancy, there are other ways for people to potentially help reverse the aging process. One way is through supplements. Anti-aging supplements are products that are marketed to improve health and longevity by slowing down the aging process. These supplements typically contain vitamins, minerals, and antioxidants that are said to help support healthy aging. Some examples of popular anti-aging supplements include resveratrol, which is found in red wine, and coenzyme Q10, which is produced naturally in the body. However, it's important to note that these supplements have not been extensively studied, and their efficacy has not been scientifically proven. Another way to potentially help slow down the aging process is through gene therapy. Gene therapy involves the introduction of genetic material into cells to treat or prevent diseases. In the case of aging, some researchers believe that gene therapy may one day be used to slow down the aging process by introducing genes that are associated with longevity. This could involve the introduction of anti-aging genes into the body or the modification of existing genes to reduce the effects of aging. Another approach to anti-aging is caloric restriction. This involves reducing caloric intake in order to slow down the aging process. Research has shown that caloric restriction can increase the lifespan of some animals, and it's believed that this may also be true in humans. However, caloric restriction can be difficult to maintain, and it's not yet clear if the benefits of caloric restriction can be sustained over the long term. Exercise is also considered to be an important tool in the fight against aging. Regular exercise has been shown to improve cardiovascular health, muscle strength, and cognitive function. Exercise has also been linked to a reduced risk of chronic diseases, such as heart disease, stroke, and some forms of cancer. By improving overall health, exercise can help slow down the aging process and improve quality of life. Another approach to anti-aging is to focus on maintaining a healthy lifestyle. This includes eating a balanced diet, getting enough sleep, and avoiding harmful habits such as smoking and excessive drinking. These lifestyle changes can help improve overall health and potentially slow down the aging process. In addition to these approaches, there are also new technologies and treatments being developed that are designed to help reverse the aging process. For example, stem cell therapy is being explored as a potential way to rejuvenate aging cells and tissues. This involves using stem cells to replace damaged or aged cells, which could potentially help reverse the effects of aging. Finally, it's important to remember that the aging process is complex and still not fully understood. While there are many approaches that people can take to potentially slow down the aging process, more research is needed to fully understand the underlying mechanisms of aging and how to effectively reverse its effects. Overall, while there are many approaches to potentially help slow down the aging process, it's important to remember that there is no one-size-fits-all solution. What works for one person may not work for another. It's important to speak with a healthcare provider to determine the best approach for you and to make sure that any anti-aging treatments or supplements you use are safe and effective. In conclusion, the discovery of the anti-aging gene and the work of scientists like Professor Paulo Madedu and Professor Anibal Puca have opened the doors to a new era of research on aging and heart disease. The potential of these studies to fuel a new wave of treatments and therapies that could help protect and rejuvenate our hearts and bodies as we age is truly exciting. While it may still be several years before we see the full effects of these studies in clinical trials, it's important to remember that there are things we can do now to help slow down the aging process and protect our hearts. Eating a healthy diet, staying active, and avoiding harmful habits like smoking and excessive drinking can all play a role in helping to keep our hearts young. Additionally, supplements and other treatments, such as gene therapy, are already available for those looking to take advantage of the latest advancements in aging research. However, it's important to approach these options with caution and only use them under the supervision of a medical professional. In the end, the journey towards a longer, healthier life is one that requires a combination of cutting-edge research and smart, proactive choices on our part. By staying informed and making the right choices, we can all take steps towards a brighter, healthier future. Thank you so much for continuing your support in our quest to deliver the best future science videos on all of YouTube. See you around next time and take care.